Hi, Kelly. Welcome back.
Hey, good to be back, Bruce.
Yeah, and so you're very popular, and a lot of people shared and then shared again our last video together because Facts Not Fear is not being sold hard enough in our media today. And
Right.
you and I got a chance to have a very open, honest conversation about real topics. I think that what I didn't do last time, and perhaps it's a disservice, not to you, you're great, but just a disservice. I don't think people understand what disaster response physicians actually do. You're a trauma surgeon.
Yeah,
Give,
I'm a
give me
I'm a trauma and emergency physician. So
okay.
that's what I did my residency in, and I worked for some years, many years, at level one trauma centers, hospitals all around the country for years, being a sort of standard trauma emergency physician and treating all the things that happen with that: gunshot wounds and knifings and car accidents. And I developed my own personal interest in the idea that there are some of these big events that happen, whether it's an active shooter or a hurricane or an earthquake or a massive accident where you end up not with one or two or three victims, but what happens when you end up with 50 or 150 or
Mhm.
more than that? And I developed an interest in that. So I actually went out and availed myself of additional training. I went to Europe. I actually worked with a bunch of folks in the Israeli army, looked at how different places did disaster preparedness and response for mass casualties, and kind of made my transition into that. I also spent about 2 decades working with Fortune 100 companies, townships, municipalities, churches, hospital systems, schools on disaster preparedness and response plans, so that all of those different entities that I'm talking about need to have thought about, wow, what would we do if we're a hospital? What happens if we're ground zero for the explosion, for the earthquake, for the hurricane? If we're a school, what do we do if we have an active shooter? If we're a church, what do we do if the roof falls in? Those sorts of things. They need to have thought about those. And the good news is that a lot of the information that we train about and teach about and think about, it doesn't matter if you're doing it for a hurricane. A lot of it can be used in other scenarios as well, about 80%.
Yeah,
So
so let's say that we're in a pandemic somewhere and a lot of people are getting sick and some of them aren't, and some of them are really struggling, especially with underlying conditions and
Mhm.
age. And we kind of figure these things out. Let's say I'm, well, for no reason, Florida, and I want to reopen my churches and schools especially coming up really quick, right? So,
Yep.
and I want to do something. So I would want to talk to somebody that was good with disaster response, disaster recovery, right?
Right.
That's what
Right.
you do.
Yes, and I actually worked with. I was at the helm with Continental Airlines, for example, in 2002, 2003 during the SARS epidemic. And Continental, which is unfortunately no longer around, but they had a huge footprint in Asia. A
Yeah.
lot of their traffic came to and from Asia. So when SARS hit, they were very, very interested in, wow, what do we do? Do we keep flying? Do we, what precautions do we take? Do we shut some hubs down? How do we take care of our employees? How do we take care of our passengers? Those sorts of things.
So
Um,
we can say this isn't your first rodeo.
this is not my first rodeo.
I just kind of
So
want that put out there because
yeah,
everybody wants to quote somebody, and I get that. God bless them. That's what they want to do. But I get people that get mad at me when I quote something that doesn't fit their narrative. By the way, your original video, I put it up on Facebook. It was shared a couple of times from there. The one you did for Arlington, Texas.
oh, gotcha.
They were all taken down. They,
Yes,
they were all taken down. It didn't meet community standards because you
yeah,
were facts, not fear. You weren't trying to sell them something. You didn't have a book in that point in time. Not
right.
that you might not soon, but you didn't have a book. You weren't trying to sell them something. And yet they
I
took it down.
absolutely no, there's Bruce, no agenda whatsoever on my part other than to try to calm down some of the fear that's really been fomented in this entire thing. Just as an aside, one of the courses that I teach is leadership in times of crisis. And if I had to boil that down and summarize, that entire body of work, what we know about people and how they lead well in crisis, is that when you don't lead well is when you're operating from a place of fear,
Yes.
operating out of panic. People don't make good decisions when they're operating out of fear. So my entire goal really with that initial video was to try to be the calm voice of reason, a measured approach, and say, here's what we know. Here's what we can base things on. Here's our reasonable things for you to do. The fact I was shocked that YouTube took it down. They took it down, and the reason they said was that I violated their community standards specifically because I said things that did not support the position of the World Health Organization.
Right.
Which is terrifying, frankly.
Yes.
It's terrifying that
Yeah.
now I believe me, I know that people say, well, why didn't you sue? It's a First Amendment. I say, no, actually, YouTube is a private company.
Yeah, they can
just
do what
like
they want. Yeah.
Google's private and Twitter's private. But what it does mean is that the Americans need to understand these are private companies.
Yes.
Nobody has a First Amendment right on those platforms. But therefore, Americans are really receiving or have access to a highly censored, highly distilled set of informational, tools at their hands. So that if you think that, oh, I'm educated, I'm informed because I went and I Googled it, or the stuff that's on Google or YouTube or Twitter or Facebook is only what they want to be up there.
Yeah,
so,
they took Anthony Robbins down too. He's one of my heroes. Tony Robbins does a great job, and they took his stuff down too. He did the same thing. He went after experts like you that actually deal with this. Now let me tell you what I think too. This is when I say deal with this. You deal with how do we handle it after we've got something spread throughout whatever it is. That's a 10,000-foot view, but you get what I'm saying.
Sure.
And here's what they were quoting. They were quoting the epidemiologists. Now, I know that it's not a popular thought, but I think epidemiologists are like the weathermen. They're the only people that I ever watch on television. I don't watch any part of the news except the weather. Their job, though, is to take data, lots of data, right? Mm-hmm. And they take models and they create models. They take known physiology. They take known population density. There's a lot of calculus that even I don't have a clue about. They put it all together. And unfortunately, at that point in time, they make an educated guess. And they're usually very good at tomorrow. And they're pretty good at 3 days from now. 2 weeks from now should have never made it to our mainstream media. Yet that's who everybody's quoting. We were told in Missouri, and I'm going to let you speak to epidemiology if you don't mind. We were told in Missouri, Kansas City, you wait, it's coming in a week. It's coming next week. The big wave is happening this week. Everybody get ready. Hale Auditorium was ready. And then it's in 2 weeks. Actually, it's going to be in 2 weeks. Well, actually, it's 2 weeks from now, and this is 6 weeks ago. And so now everybody's going, how many times you cry wolf before we're not going to rent out Hale Auditorium to have cots for people that are going to be, infected with this COVID. And so finally, it seems like people started to gain a little more reason. And now the mainstream media wants to talk about cases. So would you first talk about epidemiology and how it really is useful?
Sure, and you really summarize it pretty well, I think. Epidemiologists, and I have a tremendous amount of, of respect for them as well. The majority of them, if you count them up in the country, are not physicians. They have advanced degrees in epidemiology. Many of them are doctors, meaning they have a PhD in epidemiology. Right. Epidemiologists are essentially mathematicians. They apply mathematical models to things. To see how they will spread and how a disease process will spread, how something will move through a population, how something will be transmitted, those sorts of things. The reason I believe that we should not be hanging our hat on this and that this stuff shouldn't be reported in the media, meaning you can help to advise the people making decisions, but the public doesn't need to hear about it, is because when you apply these models, Bruce, you're talking about applying mathematical models to something in terms of how it works in a laboratory, for example, how something replicates, how something is spread there.
Right. You
can't take into account, just in this country, the 330 million souls. They don't know, how is Bruce Rippey going to respond? How is your family going to respond? How is Kelly Victory likely to act in this particular case? Because they have not factored in at all the human component and the fact that, are people going to go out and protest and riot in the streets and refuse to wear masks? Are people going to want to go to sporting events? Are people going to continue to get on the subway? Will people say, I need to go visit my my grandma in the nursing home, despite the fact that we're in a pandemic. And it doesn't take into account all of that human nature, that those things can't be factored in. That's the big unknown in the model. And therefore, the models can be wildly wrong, which is exactly what we saw.
Yeah, too many if-then loops, right? I mean, that's what was happening. If you do this, then this is going to happen. If you go to Lake of the Ozarks, that was famous. Missouri got a little bit famous because you go to Lake of the Ozarks, everybody's going to get COVID and you're all going to die. And it's not that this isn't a real disease. It's not that this isn't really something happening, but that didn't happen. And well, if you get together in protests and you get to this, then you're going to have this. If you go to church, then this is what's going to. And so people are making decisions based on an if-then. That's a mathematical theory, but it has not proven true. And I'm almost afraid that that the public is going to stop looking at the data as though it's right at all. And I think that's also a mistake. I think you need to listen to people that are in your position, that are in the positions of the healthcare workers. Those are the ones that need to be discussed. And my problem right now is that, unfortunately, because it is politicized, one of the leads in our country seems to have held every single position possible, right? And that's also starting to cause disturbances. Some people just believe whatever they're hearing, and some people are like, okay, now I don't believe anything because I've heard everything. I've heard yes and then no, I've heard black and then white, I've heard whatever, right? So I'm concerned about that. And when you take epidemiology, can they track? It seems to me epidemiologists are good at tracking things, though, back to its source. Isn't that part of epidemiology?
Absolutely. And I think that that's where they do really a brilliant job. They say, let's look back retrospectively. Epidemiologists do a great job. And that's generally what they do. You look at something and then you become a student of that pandemic or that outbreak or that whatever, that disease. You look back and say, here's what we know. Here's how the trajectory of this changed. Here's how it spread. Here was the transmission. And then learn from that going forward so you can make better predictions. Right. But if you remember, the first model came out of London, actually. That was the Neil Ferguson model.
Yep.
And he was off by an order of magnitude, such that but there are many people who still latch onto those numbers. And you were just talking about the first thing they heard about this pandemic were those numbers that came out in February from London, from Neil Ferguson's study. And then it didn't matter that later on he said, whoops, I was off on that by an order of magnitude. People still keep quoting those numbers. Yep. And so I think that the epidemiologists are incredibly important part of this whole process. But I don't think they should be front and center. They're the people, they're the folks behind the scenes that should be applying the models and looking and trying to understand what has happened as we watch the real-time data. Those of us on the front lines, physicians and people at the hospitals who actually are looking at the census at the hospital, what's really happening real time? What are we seeing? Because we knew pretty quickly, Bruce, that those models were wrong. Those of us who were out there saying, wait, this isn't what we're seeing. I mean, here's the prediction, but as you said, then they said, well, but it's going to be next week, or then 2 weeks, or the 2 weeks from next Thursday. And they kept moving it because the models very clearly weren't playing out the way that they had thought they would.
Yeah, so my chief medical officer for one of my businesses out in California actually got COVID, and he tested positive for the PCR thing. He went on through it. He said, wow, that is a rough 4 or 5 days. He's basically 50, He said that was a rough 4 or 5 days. They had him down, but now it's going to be 12 days. And he's clear. He says, I feel great. I'm back to fantastic. He goes, but believe me, he goes, it was a rough 4 or 5 days. He goes, it really was. And he thought the same way you and I think in a lot of ways is that he wasn't taking care of himself because there was such a demand and people didn't want to go in. He was doing 12-hour shifts 6 days a week in the ER. Right. He's a terrific ER physician. And he overcooked himself. I mean, he just did. And you can do that. And that's, I think, the biggest message that I try to get, because I fix the little stuff, right? I'm a chiropractor. I fix the wellness doctor fixes the little stuff. Hey, how are you feeling today, right? Not if you have a disease process, organ system, something broken, you need to see somebody else, right? But we fix the little stuff. One of the little stuff things we are is how you sleeping, how's your mind? How you eating, right?
Right.
Are you exercising well?
And honestly, I'm the first person to say this is a real virus, and there's a certain small percentage, thankfully, small percentage of the population that can become quite ill, clearly. And we know that there's a percentage of the population that has succumbed to this and died from it. But people have sort of focused on the virus and stopped looking at the bigger picture, their overall wellness, their overall immunity. I find it fascinating to watch people, some of the people who are the most adamant, for example, about wearing a mask, or you staying 6 feet away from them, or hand sanitizers, as they're standing in line at the McDonald's, with their gulpy and a pack of cigarettes in their purse. I mean, truly, I think, wow, the mask and the hand sanitizer are the least of your worries right now in terms of how you're taking care of your overall health and wellness. And there's no mask, there's no hand sanitizer, there's no social distancing enough that will make up for inadequate sleep, inadequate diet, inadequate exercise, non-managing stress, failing to all of those things that we know. So I'm not saying that if you eat well and you sleep well and you manage your stress that you could never get sick from COVID. That's not what I'm saying, but I certainly am saying you really, if you aren't focusing on those things first, there's not enough hand sanitizer in the world. That's
so we're also saying the same thing. And when I did a post out there and I said, it's not that wearing a mask doesn't exist. It does. And that's fine. If that's where you are, that's fine. But there's a whole list of things that I would say trump the mask along the way down. And now I've gone to where people should wear masks because other people are actually hurting people. It's people against people. It's the violence, that they're dealing with. Is it happening out there too? My son is going into rotations now. He's becoming a medical doctor. He's going to rotations now. And he says violence in Kansas City has spiked to 200%. They're seeing double the amount of injuries due to violence in the ERs and so forth.
It's happening all over the country, Bruce. It's tragic. I think it's really multifactorial. It's not only people are focusing on the whole, wearing of masks or social distancing. I really think it's that we have a sort of there's a pressure cooker effect right now. People are in a pressure cooker. Millions of people out of work. Millions of people struggling to pay their mortgages. They've been locked up at home with their kids for months and months and months and months. Okay?
They're not used to that. They're not used to that.
No, not at all. Okay. The kids are frustrated. So there's no outlet. People's normal outlets, going to the gym, going to the community pool, those sorts of things have been severely capped. People aren't able to do all of those sort of stress management issues. People are drinking more, much more substance abuse. We are seeing real problems. So I think the frustration level is so high right now that it doesn't take much for people just to kind of snap. Add on top of that, and I believe my first degree was in psychology, and I'm a big believer in this, that wearing of masks is a very dehumanizing thing. You walk around the grocery store and you can't see anybody. You have no idea if they're smiling at you. You don't know if they're scowling at you. Right. You don't know if they're smirking, or other than, the eyes are very telling, but when you strip away all other facial expression, and it becomes, you almost become a little suspicious of everybody. You're in with their cart and you don't want them too close to you, and you're wearing your mask and they're wearing theirs, but people are there's a real sort of a subversive effect, I think, to all of this. And I think that really is part of the reason we're seeing this huge uptick in violence all across the country.
Yeah, it's scaring me. I mean, it really is. In a lot of ways, it's one of those things that I just don't like to see it, because I don't like to see people hurt. Of course, I deal with the first responders. I have a lot of them as patients, and so a lot of them as patients. And so they're wind up having to deal with a lot more of the negative effects of this than people actually want to admit. So let's talk real briefly about your FDA. Great tweet today. I love the fact that you get to be just a little bit snarky about this, because this is one people started saying, hey, and it came out on the news, the media. I am so mad at them for this. Oh, FDA starts saying, hey, you know what? We're going to have to recall all these hand sanitizers because they might have methanol in them. The people that were injured by that were not, and they tried to make it sound like you could put it on your skin and you would absorb methanol into your body and it could cause blindness. And finally, somewhere down there, it kind of mixed the message. It was a poorly written article. It was in the New York Times, Washington Post. I'm sorry. The
Yeah, it
Washington
was
Post.
Washington Post.
And I saw this thing, and you got a chance to kind of give it a little bit of a nudge there. So tell me about this, so we can at least alleviate that fear from those of us that are using hand sanitizer when we can't wash our hands.
Well, the FDA, came out saying that they thought that 75 or 77 different brands of hand sanitizer were quote unquote toxic. And the reason they were, deemed to be toxic is because the alcohol, most hand sanitizers are made with alcohol. That's all it is. It's very simple. The alcohol in these particular ones was ethanol. Excuse me, methanol.
Yeah.
Methanol. Ethanol is alcohol that we drink, whiskey.
Right.
This was
not you and me, other people.
Yeah, exactly.
That are doing it wrong.
Right. This was
Not-
methanol. And
not
methanol, if you drink it, is highly toxic.
Yes, it is.
Okay. So isopropyl alcohol is the one that is not toxic to put on your skin. Methanol is toxic if you drink it. But unless you're drinking these hand sanitizers, you don't absorb enough through your skin that you would become profoundly ill. The reason I made a joke about it, Bruce, honestly, was I thought they've been driving home for months now, use this hand sanitizer,
Yep.
and I've said, we really are kind of overdoing it on the disinfecting people. Even the CDC came out and said that COVID-19 does not last for prolonged periods on surfaces, and we really don't need to be constantly swabbing things down with disinfectant and taking baths in Purell every night.
Mm-hmm.
So I thought it was sort of ripe that 4 months into this, now the FDA says, whoops, maybe you shouldn't have been using all these hand sanitizers that we told you to use. But in reality, unless you are drinking the stuff, methanol should not, in the quantities that most people use hand sanitizer, methanol is not likely to cause you to become ill.
Yeah, it won't. I feel the same thing. So I have a couple of little pet peeves, and I got to tell you this one. Here's one of my favorite. And my wife wondered, please, she's the left ventricle. I'm not mad at her. This is just how it goes, though. Some people are more germophobic in ways than others are, right? She gets mad at me every time I use her toothbrush. Here's the thing. She decided that when we walk into my clinic, I have a big clinic. We walk into my big clinic, and she wants a hands-free hand sanitizer dispenser, hands-free. And so what I did was I said, do you mind if I just really slowly mimic something here? Because I'm going to do this, and then I'm going to do that. Do you think the COVID got me in that half a second?
Yeah.
It was all over the handle here, but I just on purpose squirted hand sanitizer. It kills. You get this, right?
Exactly.
But no, we've got to have this over the top touchless. But the thing is though, you keep the home happy. Wife's got to stay happy, but you keep the home happy. But I'm telling you, this is one of those things like, really think about what you're saying there.
Right.
And sterile. I think that you have these people that are struggling, restaurants and so forth, that are struggling, and now they're having to hire more staff in order to be able to squirt things down and hose them down and wash them. And this is not how it works. It's not how it spreads. It's not how it. So it's crazy that in my gym I have to wear a mask all the way up to the workout facility. Now there's not a ton of people in there, but I work and that's too bad in a lot of ways. And then I can do my workout without my mask on because that would just be stupid. And then I got to put my mask on in order to be able to be on the stairs. And every now and then you'll get somebody where you're walking down the stairs, you're talking to somebody and they're like, up over the nose, please. Up over, over the nose. Up over. Thank you. Just, okay. Thank you.
Right. No, welcome to Stupidville. I'm in Colorado where you have to wear the mask while you're exercising.
You do.
The whole time. You have to wear the mask while you're exercising, which is patently absurd. I don't know how people do it. I'm fortunate enough to have a gym at my home where I can work out because I could not go and be on the elliptical or the treadmill or whatever with a mask on. I would get too short of breath. We're already here at altitude where the air is a little thin.
Yeah.
So it's crazy, but I have that same interaction with people where they're telling me to pull my mask up over my nose, and if I had time, I would love to say, let's sit down and have a reasonable conversation about how masks work. But
don't try to Mythbusters it. They learned something 4 months ago. If you've learned something 4 months ago and you don't want to listen to Mythbusters now, because I learned this something and now I've learned it, I'm going to just believe it. So open our schools for us, Kelly. How do we do this? Come on. This is something I'd love to see happen. It looks like everybody's on your side with this, actually, and they want this too. Help us open our schools. What do we do? How do we remove this fear?
Well, and that's the whole issue is let's look now. Let's not talk about epidemiologists. Let's talk about what we actually know now about COVID-19. Here's the first thing we know. We know that children are at an extraordinarily low risk from this virus, so low as to say it's almost truly 0%. Are there some kids who could become ill with it and become significantly ill? There are a handful. But if you look nationally at what's happened from the beginning of this, meaning from February 1st, the number of deaths attributed to COVID-19 in people under the age of 18, so far, the CDC says 30. There are 30 deaths in people under the age of 18 in the entire country. And even those, if you read the fine print, the CDC says, we aren't sure that COVID-19 was actually responsible for the death, but it was somehow involved, meaning the child may have been on chemotherapy, had diabetes, these other sorts of things.
Could have lived longer, but maybe COVID helped it along.
Right. But the risk to children. So let's start. The first thing, the risk from a child becoming significantly ill from COVID is essentially, I would feel comfortable saying 0.
Right.
Okay.
Right.
Then.
Right.
Now, the next argument was, okay, well, we'll give you that. It's not that the kids are going to get sick, but what about the fact that they're going to spread this to the teachers and bring it home to their parents or their grandparents?
There you go. So tell us about that.
Well, the good news is 22 countries around the globe have opened up their schools fully. No mandates, no masks, no social distancing, no restrictions. And they didn't just open up yesterday or the day before. They opened up 6 weeks ago now. And in 6 weeks, in 22 countries, they have not seen an uptick. They haven't seen the childhood cases, just as we would expect they wouldn't. But furthermore, they haven't seen spread to teachers. They haven't seen spread to parents or, God forbid, to elderly grandparents. It simply isn't happening. So it's proving what we already suspected about children, which is that they are very poor, what we call vectors of the disease. They simply don't spread it, because it's believed they carry far less of the virus, what we call viral load, in their noses and mouths. Even if they get the virus, they just don't carry very much of it because they fight it off incredibly quickly. More frankly, most of them seem to be fighting it off before they even develop antibodies, because their immune systems are good at fighting this. So it isn't spreading, all right? So you take those two things. Then let's look at what's the downside, because in public health, one of our mandates, Bruce, is to look not just at an individual, but let's look at the long-term or the broader reaching ramifications of keeping school closed.
School, right? Yeah, I get it.
Okay, well, obviously everybody knows the first thing is their academics.
Right.
We are profoundly impacting their academics. We know that this remote learning thing is not what it was, first sold to us to be. It simply isn't as adequate or any kind of a replacement for in-person teaching.
Right.
The predictions right now, according to places like the American Academy of Pediatrics, is that kids right now are already about 35% behind in their English and writing skills because of the shutdown, and about 50% behind in math skills, just because of the shutdown of schools at the end of last academic school year. And those numbers are even higher in underprivileged populations. So Black and Latino kids are likely to be even further behind.
Yeah, that's scary.
Then so that's the academic side.
Right.
Then you take the psychosocial piece.
Yes.
Well, for example, we have 30% decrease in the cases of child abuse and neglect have been reported. 30% down. Why? Do you think it's really because kids locked up at home with their parents for the last 4 months that the abuse isn't happening?
No, because the teachers aren't.
It's because that gets diagnosed, that gets picked up at school. It's the math teacher, it's the health teacher, it's the football coach who picks up that neglect and that abuse. We're seeing a huge decrease in reports of kids with hearing and visual issues. Why? Not because they all of a sudden aren't having them. They're not at school. Parents are not the ones, interestingly, who typically pick up vision and hearing issues. It's a teacher who's saying, Johnny clearly isn't seeing the board. So there are a lot of things other than the fact that kids are falling behind in math and science and reading, which is bad enough. There's all of this other stuff that they're missing. So I believe that given what a low risk they are, given what a low risk they are to be a vector to spread it to others, and all of these other negative impacts, I think it's imperative on us to open it. And if you want to talk for a second about schools, let's look at who's at risk from teachers, the teachers, the lunch lady, the cafeteria ladies, the custodians, all of those support people. Well, in the United States, in the public school system, 56% of teachers are below the age of 40. 56. 80% of them are below the age of 55. So the vast, vast majority of school staff do not, at least by age, fall into that risk category for COVID-19. Now, if I were a 70-year-old, 75-year-old teacher who was obese and had diabetes, maybe I would choose to say, okay, well, maybe I need to be a little more cautious. I might choose to wear a mask, not to protect me from the kids, but to protect me from the other teachers in the teacher's lounge.
Right.
Or I might say, you know what, I'll skip going to the group lunch and be a little more cautious because I am in a risk category for COVID. And now that I'm back at work, but the risk isn't coming from the kids.
Right. Yeah, I think you'd have them wash their hands when they leave the building. It just becomes part of it. It just becomes, okay, well, you're going to be here. You're going to do whatever you're going to do here. You're getting ready to go home. Wash your hands as you leave. Because like you said, nose and mouth, it's pretty low. There's two different levels of an immune system. One's the very beginning, one's a little bit later with antibodies. Speak to that for just a second. That's why the kids are shrugging this thing off, yes?
Right. Yeah, you're exactly right. Everyone thinks that, well, if you don't have antibodies, you can't fight anything. We fight stuff all the time. Oh my gosh, if you took a swab of your arm or of the handle on the sink or the countertop in your kitchen and looked at it under a microscope.
I'm not willing to do that.
You're right. It would give you the heebie-jeebies. I mean, there's a lot of stuff out there, and not because people aren't good at keeping their homes clean, but there are a lot of microbes out there. Yep. All kinds of things that we come in contact with every day, and we don't succumb to all of them. They don't make us ill in large part because we have these wonderful immune systems that are very good at fighting that stuff off. And we don't need to form antibodies to all those things. Right. The first line of defense are our T cells. Our T cells are the fighter cells that get out there, and many, many times we're able just to wipe whatever it is out without ever developing a more complex immune response or needing to develop those specialized soldiers that we call antibodies.
Sure.
When it comes to COVID-19, children appear to be really, really good. Their T cells just get out there and wham, knock the virus off its feet, and they never really even get infected with it. Most kids who have tested positive haven't gone on and developed antibodies. Older kids, as they get, as you might imagine, into their closer to being adults, 15, 16, 17-year-olds are more likely to develop antibodies. But the younger kids seem to wipe it out without a hitch at all because they've got a lot of those natural killer cells already in their bloodstreams, and they just don't become ill with it.
So here's the last question for you, and I so appreciate your time. You have no idea. So here's the great thing. This is facts, not fear. This is what we're actually basing this on. What could we do to boost our own front line against this virus? What could I know you and I do this a lot. What could we do though, as I'm 55, as a 55-year-old man, just trying to make it through the next day? Tell me what's a good idea for everybody out there to do on a regular basis so that they can make themselves more active on that front line of defense.
Well, obviously, the key things, first of all, is healthy diet. And when I say healthy diet, I'm like the next guy. I eat chocolate chip cookie. I fall prey to eating sweets, those sorts of things. Overall, balanced, healthy diet, big on fruits and vegetables. Adequate sleep. I cannot say enough about adequate sleep. And honestly, sleep deprivation, chronic sleep deprivation, Bruce, I think is really the smoking of the 21st century.
Really? It's that bad?
Yes, because we have all of a sudden the ability to be 24/7. When I was
Yeah.
growing up, my
Oh,
dad
yeah.
came home for dinner. Yeah, right. My dad came home for dinner every day, every weekday at 6:30 because the switchboard at his office closed.
Yeah.
And you
Yeah.
couldn't there was no cell phone, there was no computer.
Right.
The day's over. There's no one there to answer the phones and the
Right.
telephone, those sorts of things. We now have this 24/7 ability with our laptops and our cell phones. You can always be buying something, reading something, trading, so sleep deprivation is a big deal. So good diet, adequate sleep, regular exercise, and that has become a challenge with this COVID thing
It has.
because so many gyms are closed. I feel for the older population, many of whom, swimming, for example, water aerobics was their only outlet, and
I
all
know.
of these community pools have been closed. Regular exercise is critically important, not just for your body, but for your brain. It's hard to be in a bad mood when you're out walking, taking a brisk
Right.
walk.
So
It's
true.
hard to, it really is. And so that's critically important. Stress management in general is unbelievably important. And unfortunately, as we were talking about early in the segment, I think there's a frustration and a growing hopelessness through this pandemic that is making people just elevate because what happens is it's not just the way you feel. You actually elevate stress hormones. Cortisol, it's the
Yep.
number one stress hormone. When that is up all the time, it does unbelievable damage to your cells. It's really, really toxic.
Yeah, if you're going out, I so agree with you. I don't mean to cut you off, Kelly. It's just you see it it's almost like people will snap too, because they'll be out with their mask and their whole thing, and they'll see somebody without a mask, and they'll get that, and I'm
Right.
like, do you realize what that just did to your system? You just made yourself
Exactly.
susceptible to the one thing if you go up to somebody and say, hey, I think you're supposed to wear a mask here, or whatever that is, that's liable to help you. But
Right.
that adrenalized state, that spike in adrenocorticotropic hormones and so forth, this is not a good idea.
Right. We are well-tuned beings. We are the Porsches. But even a Porsche isn't meant to run, at high RPMs all the time. Okay. It's meant to be able to kick it up when it needs to, but then ramp it down. You don't just sit and gun that engine all the time. And that's what cortisol, and that's what high stress, and that's what adrenaline does to you. It makes you rev your engine all the time, and it has really long-term effects. Then the other thing that I would say right now, and always during cold and flu season, but during this particular outbreak of the virus, I have increased my taking some supplements.
Sure.
It won't ever replace a good, healthy diet, but we know, for example, that vitamin D is critically important for this particular virus. So vitamin D, vitamin C, and zinc.
Yep.
And I'm supplementing zinc now, which I really didn't do significantly or not conscientiously enough prior to this COVID-19 pandemic. So those three, vitamin D, vitamin C, and zinc, are worth supplementing. There are lots of others that you can take on top of it. And as I said, it won't replace a healthy diet,
Right.
but it's worth supplementing those vitamins, I think, and they're easy to supplement.
Yeah. I just really appreciate that. I love the Facts Not Fear. I hope people follow you on LinkedIn. I'll put a little attachment here. I'll tag you on it. I'll go ahead and put it out on LinkedIn too, and I'll tag you in it, or however that's done, so that we can do this. But I really think that that's what needs to be done. I know people are panicking right now. They're wanting to say, well, I'm not going to put my kid back into that stew of disease that's called school. And I feel like that's really the exact wrong way you want to go with this thing. And so I really appreciate, from an expert, someone that actually knows how to put things back together after things have gone wrong. It's really helpful to hear that, honestly, now.
Well, I will tell you, the last thing I would say about the school issue is that even the American Academy of Pediatrics and the New England Journal of Medicine Pediatrics came out and said, know this, children are at about 4 times higher risk of becoming significantly ill with influenza than they are of COVID-19. So
Right.
if we are going to use this as our new model, we will need to shut schools down every year from October till the end of March for flu season. Okay?
Yeah.
People send their kids to school every year. Do some kids get sick with the flu? Yes, they do. Far more than will ever get sick with COVID-19. Really, people need to have so much less fear than they do. Kids are being, I believe, truly harmed by being out of school. We need to get them back there. And we need the parents to be able to get back to their own jobs, and they can't do that if they're staying home with kids.
And focus on the kids' diet and their exercise
Yeah,
and stuff like that too. I mean, focus
you
on
better
that.
believe it.
That's something that you can do right now to help. So, all right, my friend, I'm so glad to do that. We'll be back to do this again. I'm sure something else will follow back around, but I really appreciate it. I'm sorry they take your videos down. They shouldn't, in my
Well,
opinion. You know, it's just kind of, but took a
yeah,
life of its own there, didn't it?
it did, and it's well, it's mostly frightening because again, I think it's just hopefully people understand. Wow, if they took that down, it was sort of it was a pretty plain Jane. There was nothing political about it. I never say the name of any politician. I didn't even say the
Not to
name
hear
of any.
them tell it. If you hear them tell it, oh, you're
Exactly.
something.
Oh, I'm a conspiracy. I always say to people, what's the conspiracy that I supposedly am fomenting? I can't imagine. Truly, I have no agenda other than to try to help people feel better about it and feel better about getting on with their lives. Say, hey, we don't succumb to all these things. You know, I worked in huge level 1 trauma centers and was in the front line during the HIV outbreaks and hepatitis outbreaks and all these things, you know, and managed to not get it to, you know, become deathly ill from it. We can certainly control this. We can rally around and protect the people, Bruce, who we know are at high risk, that elderly population. Americans are good, caring people. We can take care of the folks who need to be taken care of while not harming everyone else.
I think that's the best way in the world to end this, and I sure hope that that's what people do. So thanks again. I'm going to go ahead and stop recording. I'll talk to you for just a second.
Okay.